Good afternoon, and thank you for being here today. I'm joined as usual by Dr. Cantor. He will be speaking to you in just a few minutes with an update. We've got a couple of announcements to make today that I believe are rather exciting and continue us on our path through this pandemic. I can tell you just at the outset that we're obviously doing better. There are some reasons for concern, but overall we're in a much better place. I do want to start, however, by addressing the weather that we experienced yesterday across the state of Louisiana. And in fact, it was felt all across the southeast portion of the country. Overall, we fared very well considering the forecast and the likelihood of very severe weather with damaging winds and possible strong long track tornadoes. There were a couple of possible tornadoes in Union and Washington parishes. The National Weather Service is working to confirm those tornadoes. There was a total of 5 homes that received major damage. Tarps and other resources are being supplied by local emergency responders. No parish has declared a disaster and no parish has requested assistance from the state. Most importantly, we have learned of no injuries or fatalities. And so that's obviously a very good thing. So we feel very blessed today that it wasn't worse than it was, because it had every potential to be. Shifting to our COVID-19 update, the first announcement I'm making today is that as of Monday, we're going to expand vaccine eligibility to include all essential workers in Priority Group 1B, Tier 2. And this is regardless of their age, regardless of their underlying health conditions, except that you have to be at least 16 years old. I'm going to quickly go through the list. It'll be up here for you to see as well. But this includes higher education faculty and staff, food and agricultural workers, food service workers, so restaurants, bars, hotel workers and other hospitality workers, judiciary personnel. So that's clerks of court and their staff, DAs and their staff, judges and their staff, public defenders and their staff, and court advocates such as CASA and others. Postal workers will be included, manufacturing workers, grocery store workers, transportation workers, bus drivers and so forth. And that also includes river pilots, water and wastewater workers, energy workers, bank tellers, construction workers, clergy, IT and communication workers, media workers, public safety engineers and other similarly situated workers, public health workers, frontline government workers, child, youth, family service workers, veterinarians and support staff, waste management workers, public and private security and emergency preparedness workers. So those individuals have been added to the list. Their eligibility starts on Monday. Like previous workers who were eligible by virtue of their occupation, they will schedule appointments just like anyone else. They will identify themselves as an eligible worker, and then when they show up for the vaccine, they will need to present an ID badge, pay stub, a letter from their employer, something that evidences the fact that they work in these occupations that make them eligible. This change obviously applies to everyone 16 years and over, 18-year-olds. I realize that many people in the groups that I just listed are already eligible due to having one or more underlying health conditions that the CDC has identified as making them more vulnerable to disease and in a high-risk category. Our strategy in Louisiana has been to vaccinate our most high-risk populations first in order to preserve hospital capacity and protect those most likely to have a severe outcome from COVID, And certainly, foremost among our objectives was to minimize the death associated with this terrible disease. We are seeing some encouraging trends when it comes to hospitalizations and percent positivity. I will tell you the number of deaths we're reporting every day is stubbornly high, and I am looking forward to their profession. And many have not had the option of being able to work from home because they were essential front-facing workers. Those individuals have carried our state through these most trying times, and we want to make sure that they have the opportunity to get the vaccine if, in fact, they are not already eligible. I will tell you that I believe this will be the last expansion of eligibility that we're going to make before we open it up to the general public, meaning the only move that I can see at the moment going forward into the future will be to say everybody in Louisiana who's 16 and older who wants to have the vaccine and hasn't had it yet, you're now eligible. We're not making that announcement today, and I'm not sure when we will get there, but it's pretty clear to us that that will be the next expansion of eligibility. We know, and you know, that President Biden has established a goal of opening up eligibility to all adults by the start of May. I do believe we will beat that goal in terms of getting there sooner. I just don't know exactly when. But based on the allocation of doses that we've been told to expect over the coming weeks, we don't think that the doses available will be a limiting factor, and so it will simply be a factor of when we detect slack in the system that we have for appointments and for the administration of the vaccines. Again, the expansion that I just mentioned to these essential workers who've been added to the eligibility list, they go into effect on Monday. We, as I mentioned, are continuing to see encouraging trends with our numbers related to COVID-19. Today, we are reporting 558 new cases on 21,996 new tests. Sadly, we're also reporting 19 new deaths for a total of 9,974. So we're just 26 deaths short of 10,000 in just over a year that we've been in this pandemic. Currently, we have 414 people hospitalized. That is down 32 from the number that we reported yesterday. 67 of those hospitalized individuals are on mechanical ventilators, and that is up 1 from yesterday. Statewide percent positivity is 2.9%, so just a little below 3%. That's the lowest it's been since the start of the pandemic. Hospitalizations are the lowest that they've been since late March of 2020, so almost a year. And I don't know if you remember, but they kind of slowly went up to 500, and then within a couple of days they were at 1,500. Today we are just above 400 is what we're reporting. I do want to thank everybody who's working so hard on all elements of COVID-19. And by the way, testing continues. Vaccinations obviously continue. There's an awful lot of work going on. And we have a lot of good partners, both in the public sector and the private sector. The work being done out of the Department of Health and the Office of Public Health has been tremendous. And one example of the fruits of that is that Louisiana is leading the nation currently in people who get their second dose on time, which is important. But I also think that this is a testament to the hard work of our vaccine providers and how much the people in Louisiana really want to get back to normal and to protect themselves and their families, their friends, their coworkers, and even strangers that they don't know. More than 500,000 people have completed their COVID vaccinations, which is more than the total number of people with confirmed COVID cases. So these are good trends. They're great trends, actually, and they're hospitalizations. There is growing evidence that this is due to the variants of the virus out there. and to some other factors as well. Thankfully, we haven't seen these in Louisiana, but as we know, and we've seen for a year now, this pandemic has a mind of its own. This virus does, and it is very important for us to continue to do what we can to minimize the transmission, especially in light of the variants, while we do everything we can to speed the vaccinations. And so doing both of those things simultaneously is incredibly important. That's why we have to keep wearing our masks. We have to socially distance, follow the mitigation the measures that we know work, and certainly we have to get the vaccine when we are eligible. I am happy to report that as of 2 days ago, I am fully vaccinated, meaning I'm 2 weeks past my second shot of Pfizer. And people are fully vaccinated per the CDC when they're 2 weeks past their last shot. So whether it's the second shot of Pfizer, the second shot of Moderna, or the single shot of Johnson & Johnson. And like many other Louisianans, one of the things that I look forward to the most, and I think I'll get this opportunity on Saturday, is having a nice visit with my 85-year-old mother. So that for the first time in well over a year, we can hug, take our mask off, enjoy a meal together, and have a really good visit. And I mention that because this is just one of those things that returns us to a semblance of normalcy. And it's something that was relatively minor in our lives. I mean, it's always special to be with your mother, and I'm not minimizing that, but it's something we all took for granted, but we don't take it for granted after a year during a pandemic. Really looking forward to that, and to all the other benefits that are going to come from being fully vaccinated and being around others who are fully vaccinated so that we can fully take advantage of these opportunities. And it's because of the vaccines that we can look forward to more normalcy on the horizon. But the vaccine by itself just sits in a freezer. We've got to have people's arms to put them into. It's really vaccinations that are the key here. And so it really is up to the people of Louisiana, it's up to the people of the United States of America as to how much normalcy we get to experience and when, and that'll be determined by the speed at which and the number of them who decide to be vaccinated. Obviously, we want everyone in Louisiana to have the opportunity to get the life-saving vaccine just as soon as possible. And so today we're also announcing a strategy to make that happen. The charge of the campaign is to follow the data and work with local partners to meet people where they are, to listen to their needs and work creatively to break down barriers so that every Louisianan has the opportunity, a meaningful opportunity, to get the COVID vaccine. We're going to begin with 9 pilot programs, 1 in each public health region, to bring the COVID vaccines to communities of concern through community pop-up events and targeted outreach. Currently, these events, around the vaccination events, are scheduled to take place the 2nd and 3rd weeks of April. It's a massive undertaking, and it's one that we're asking for help from partners because, quite frankly, the state cannot do it alone. We need strong, diverse, trusted community partners to help break down whatever barriers may exist so that residents can make informed decisions when it comes to getting vaccinated. We are excited to kick off this effort, this grassroots model of vaccine allocation and outreach with 20 initial partners. And I'm going to read through those. AARP of Louisiana, the AFL-CIO of Louisiana, the COVID-19 Health Equity Task Force, the Hispanic Health Equity Task Force, the Louisiana Association of Business and Industry, the Louisiana Hospital Association, the Louisiana Independent Pharmacy Association, the Louisiana Legislative Black Caucus, the Louisiana Legislative Rural Caucus, the Louisiana Primary Care Association, the Louisiana Public Health Institute, the Louisiana Rural Health Association, the LSU Ag Center, the NAACP of Louisiana, the Power Coalition for Equity and Justice, Together Louisiana, the Urban League, Viet, local efforts including NOLA Ready and the Baton Rouge Health Equity Vaccine Task Force. Several of these partners have been doing this type of grassroots work on the COVID-19 vaccines at the local level, and we're looking forward to coordinating with them further on these efforts. And this is just the start. And we do welcome other organizations, whether they're businesses, whether they're in the faith-based community, you name it, to join us in this mission to ensure that no community is left behind as we work to end this pandemic. So if you'd like to get involved, and this involves making calls, knocking on doors, if you're a medical professional who's open to answering questions about the vaccines, you can let us know by filling out our Bring Back Louisiana survey. LDH and I will share on our social media channels, but it's also on the LDH website at covidvaccine.la.gov. There at the top of the web page is a button that says, "How can I volunteer?" Click that button and join our efforts. These vaccines are our best chance at restoring a little normalcy, getting back our economy on track, bringing back the Louisiana that we know and love. Most importantly, they're the key to minimizing transmission, hospitalizations, and deaths of our fellow Louisianans. So at this point, I'm going to turn it over to Dr. Cantor. He's going to speak about this campaign and why it's important, but also tell you more about COVID and the variants. When he is done, I will come back up to answer your questions. And as always, I would ask you to address your questions to Dr. Cantor before he leaves the podium.
Thank you, Governor. Thank you for your leadership. Good afternoon, everyone. Very excited to be sharing with you what the governor just previewed and the campaign. And I'll also add, my wife and I are hosting my mother right now, who's in town, fully vaccinated, and she got to spend some time with her granddaughter, who's young and first time in 12 months, so she was able to spend it without a mask, without distancing. And to me and her, that's just worth everything in the world. And what this campaign is about is letting other people experience that, extending that to everyone in Louisiana, because it's time. It's time to do that. So that really is why I'm so excited to be talking about the Bring Back Louisiana campaign. As the governor mentioned, up until now, and perhaps for the another week or so, we've been real limited by supply of vaccine. That's really been the limiting factor in how quickly vaccine has gotten out to the people of Louisiana. Thankfully, that's going to change. And in repeated conversations with the White House and Operation Warp Speed, they are predicting to us that by the beginning of April, we're going to have significant increases of vaccine across all lines, particularly with the Johnson & Johnson, which is so easy with the one shot and you're done. Looking ahead to that, we have our work cut out for us to make sure that the people of Louisiana feel empowered to get the vaccine, that they've had an opportunity to have their questions answered, and that they feel comfortable. That's what this campaign is about, is enabling those type of conversations in every pocket of Louisiana. And I really do mean every pocket of Louisiana, because with the transmissibility of this virus, and particularly with what we know about asymptomatic transmission, it is clear now that when one community is left behind, we all fall behind. And this campaign is going to be about bringing all of Louisiana on board with vaccination. It's how we're going to get to herd immunity. And we could not be more excited about it. The change with supply increasing is going to be a challenge that we're going to meet with creativity and unconventional approaches. And what is new about this campaign is we will be marrying the data that shows which communities are doing better and worse with vaccine, and what their social vulnerability is, with actual outreach and access to the vaccine. And we'll be marrying that outreach with vaccine events, the ability to get the vaccine. So imagine canvassing efforts and people knocking on doors and reaching into communities, not only to engage and talk about the vaccine and have questions answered, but offer to sign people up for an event coming the next week in their own community. That's what it's going to take to reach every corner of the state, and that is the campaign, the Bring Back Louisiana campaign that we are launching right now. The goals of this campaign will be to increase awareness and build confidence about the vaccine, to provide safe spaces for people to ask questions, talk about what they're unsure about, and get evidence-based answers to those questions, to amplify the really great support that already exists in communities and leverage those resources to the maximum benefit, to offer a warm handoff to other resources that exist, and most importantly, to help eligible residents get signed up to get the vaccine. That's what this is going to be all about. I will share that just this week, the CDC put out an interesting study showing that to date, communities that are more vulnerable, as measured by the Social Vulnerability Index, to date are less likely to get vaccinated. That certainly fits with what we've seen so far in some pockets of Louisiana. And I think we're going to need a creative, grassroots, boots on the ground campaign like this to really address that. And I'll tell you, in some way, this comes a little bit full circle for Louisiana, because the Social Vulnerability Index that we're looking at, and that is the standard right now used by the CDC to gauge how vulnerable a community is, particularly in times of disaster, that index was actually created as a result of Hurricane Katrina. So there's a special connection to us in Louisiana. We're going to be looking at that to identify vulnerable communities. We're going to be marrying that to granular data of where vaccinations have already occurred, and using that in an evidence-based, data-driven fashion to drive this type of outbreak. I want to talk a little bit about the model itself. The first step in this is using data to identify the target census tracts of where we need to do more work to get people vaccinated. We'll be using the CDC's, as I said, Social Vulnerability Index, marrying that with our vaccination data and looking at racial demographics as well. That's what's going to guide where the 9 pilot sites are. That's where it's going to guide where the efforts are after that as well. We'll be doing ongoing and rapid evaluation. The Louisiana Public Health Institute will be partnering with us because we want to make sure that what we're doing works. And if it doesn't work, or if it's not meeting the measure, we'll be changing it midstream. So there'll be rapid and real-time evaluation of these efforts going on. The next step in this is to plan COVID-19 community vaccination events. And we'll be looking to partner with at least one community-based organization for each event, because I think this is important to have the backing of state government, the backing of the health department, be based in good data, but on the ground be led by trusted messengers and community organizations that know the community, know what is needed, and know where the people are, to be frank. And the last part of this is targeted outreach ahead of time, up to 2 weeks ahead of time leading to events. It's not enough just to host an event. You have to have the ground game. You have to have outreach ahead of time to let people know about it, give people an opportunity to ask questions, have conversations, be connected with an expert if they would like to. And that's the real linchpin of this initiative. There'll be activities including phone banking, door knocking, canvassing, working with faith-based leaders and local businesses to accomplish this proactive outreach. We'll be looking to community partners who will be able to provide facts and data, help interested residents sign up for upcoming vaccine events, and to connect them with other resources that might be helpful. And then, of course, we'll be employing both paid and earned media to promote these events. So it's going to be an all-inclusive, wraparound effort. This is what we think is needed to really get over the hurdle. And again, looking forward, 2 or 3 or 4 weeks down the road, supply of vaccine, thankfully, is not going to be the limiting factor. The limiting factor is going to be how well we've reached people in Louisiana, how easy we've made it for people to get vaccinated. And this really is a novel approach because we're marrying the data with the outreach and actual vaccine events in communities. So we're really, really looking forward to this. I think the Bring Back Louisiana name is perfect because that's what we're looking to do. We're looking to get back to normal. And that's not going to happen until we get enough of our neighbors and community members vaccinated, and I think this is how we're going to do it. So I could not be more excited about this. I think it's going to be novel, it's going to be data-driven, it's going to be important, and I think it's going to be fun, because this is going to be how we get back to normal, step by step. Let me talk a little bit about what is going on with the pandemic itself and then with vaccines in general. As the governor has said, we have a lot of good news to share right now and a number of historic lows for Louisiana, which is encouraging. We have the lowest number of hospitalized COVID patients in hospitals throughout the state that we've had really since the first surge 12 months ago, that 414. We've not been below 500 since that first surge in March. We have the lowest percent positivity right now of 2.9%. And this past week, we have had the lowest number of new nursing home cases identified in new COVID cases identified in nursing home residents to date. All of this is evidence that we're doing a good job of stopping the spread, good job of using the mitigation measures, and that the vaccine strategy is working. Because as we have driven vaccine first and foremost to the most vulnerable people, the people most likely to suffer complications if they get infected with COVID, we have now seen a commensurate reduction in hospitalizations. That is really encouraging news. It's even more encouraging now that we're able to expand vaccine eligibility even further, the last remaining step before we get to full open. That is very, very exciting news for us. This is all about access today, all about access to vaccine and how to connect people to vaccine. The one area that I am concerned about, I'll say, is the Lake Charles area. And we are seeing increases in cases right now in Lake Charles. They've been going up for about 2 weeks. It's also the area of the state with the biggest burden of the B117 or the UK variant, which we believe is driving part of that outbreak. I also know people in Southwest Louisiana have had just a heck of a time this year, and it's been incredibly challenging rebuilding from the storms, and I know that COVID is probably not always first of mind, and there's a lot of fatigue. At where we are right now, in this race against time, trying to get as much vaccine coverage out there before these variants really spread further, I got to encourage people, particularly in the Lake Charles area, just hold on a little bit longer. This really is a crucial 3 or 4 weeks for us. It's a make or break 3 or 4 weeks for us. So I am watching very closely the Lake Charles area. We have directed additional resources that way, some more vaccination strike teams, really trying to get ahead of it. I want to encourage the folks out there, just stay vigilant a little bit longer, because this is really, really a crucial time for us. I'll also let you know that we are adding 2 additional retail pharmacy partners to the federal retail pharmacy program. This is an initiative of the White House, and it's a mechanism by which we drive additional vaccine supply to Louisiana. So currently, Walmart and CVS have been participating in this program for us, and participating really means that they get the vaccine supply not through our state allocation, but from a dedicated federal allotment, directly from the feds to them. As of next coming week, we'll be adding Southeastern Grocers, which is the parent company of Winn-Dixie. They have 21 stores across the state that have pharmacies, and they'll be participating. And we'll be adding Walgreens as well. We had been supplying Walgreens through our state allocation. This will supply Walgreens directly through the federal allocation. This is all about getting more doses into Louisiana quickly. The federal retail program to date has brought 185,000 first doses to Louisiana on top of what we've gotten on the state allotment. This is going to add even more to those, so we're excited about that. Looking forward, next week will be week 15 of the vaccine rollout. Our allocations from the feds are flat. So no change from this prior week's allocation. That means for Pfizer, we'll be getting 62,010 doses. For Moderna, we'll be getting 45,000 doses. And for Johnson & Johnson, we'll be getting 5,200 doses for a total of 112,210 doses. We are employing a maneuver to bring an additional 14,700 doses into the state for next week. We're transferring the 14,700 from the long-term care program into our state allotment. As that program goes through and gets closer to completion, we're able to predict how much might be left over. So we feel comfortable moving 14,700 over into the state allocation. So the effective total that we'll be allocating as a state in the coming week will be 126,910 doses. I continue to have concerns about the B117 variant or the UK variant. To date, there's 123 confirmed or suspect cases of the variant in Louisiana. It continues to be a tip of the iceberg scenario where we just don't do a lot of sequencing yet in the country. So when you have 123, you know you probably have many, many more that you just haven't fingered. Those 123 come from every region of the state except for Region 8, the bulk of which is in the Lake Charles area, followed by Region 1, or the greater New Orleans area. The CDC has put out some interesting data. They've used routine blood samples to estimate the prevalence of the B117 variant in a number of states, including Louisiana. So they estimate right now that of all COVID virus circulating in the state, 2.9% of it is the UK variant. Compare that to Florida, which is 8.4%. Compare that to Texas, which is 1.8%. Currently, the UK variant is in 49 states, probably in 50. They just haven't identified it yet. We have not yet identified a case of the B1351 variant. That's the one that was predominant in South Africa. It has been identified in 25 states, the closest to us being Texas, Florida, Tennessee, Georgia, North and South Carolina. We have not identified a case of the P1 variant. That's the variant that was circulating in Brazil. It has been identified in 12 states, the closest to us being Texas, Oklahoma, and Florida. As the governor mentioned, there's at least 14 states now that are experiencing increases in their outbreaks, including Mississippi and Alabama. So I think despite all the good news, we have every reason to be vigilant, looking at what's happening across the country, looking at what's happening in Europe right now, and with what we know about these variants. It is a race against time. We got to get vaccine out as quickly, as equitably as possible. And again, that is why I'm so excited by the Bring Back Louisiana campaign, because at the end of the day, once the supply picks up for us, it's going to be us to make sure that everyone in the state has had an opportunity to ask questions, understands the facts, and more importantly, knows where and how to go to get vaccinated. And at the end of the day, that's what this campaign is going to be all about. Could not be more excited about it. I'll pause there. Be happy to answer any questions if there are. Melinda?
An update, you mentioned taking some of the doses from the long-term care partnership program over. Where are we in terms of how many more weeks are we expected to have doses even diverted to that program, and what's the uptick percentages in both residents and staff?
I think ballpark, somewhere between 1 and 2 more months until the program totally ends. A little bit depends on how they get scheduled. They had to reschedule a couple of dates from the storms before, and then every now and then something comes up that make a team have to reschedule. Total administrations to date, this is all first and second doses and residents plus staff of the program is 86,807. They're just about completed the third visit for the nursing home part, the part that went first, and then they'll finish up. They've been doing the Part B, which is assisted living and group homes, simultaneously, just a little bit delayed. So they'll be finishing those up over the next month or so. We have asked them, they did 3 visits. So first visit to a facility, a second visit a month later, and then a third visit. And sometimes on the second visit, people say, I want to get the shot, who didn't get it before, so they give a first shot. We had asked them on the third visit to continue to make first doses available to anyone who couldn't get it the first 2 times or didn't want to or whatever. So there will be an opportunity to follow up with those individuals in nursing homes, for example, who got a first shot on that third visit once that program ends. And those will be done by connections to local pharmacies.
What's the percentage of residents in nursing homes and staff in nursing homes that have?
It hasn't changed much since the last time we talked. It's about 82% uptake in residents of nursing homes and about 36 to 38% uptake in staff of nursing homes. Yes, sir.
Last time eligibility was expanded, there was a push to, not end the week with any vaccines on the shelves. What are you guys seeing from providers as far as, getting shots in arms? Is there still slack in appointments, or what are you guys seeing on that front?
What we've heard is not slack or not waste dosages, but the time it takes for someone to schedule might have been 3 or 4 days out a week ago, and now it's maybe the next day. So it was a kind of a signal that it's probably a good time to expand. Have not heard of a lot of doses, going unused. I think providers have been really good. If they put aside a certain number for a day and they don't get that number on eligibility, we've asked them, listen, if you get close to the end of the day, use that on anyone that you can find, and they've done really good to that. I can tell you for wastage dosages, the total right now is 1,782 waste dosages. That's on a total number of shots administered to date of about 1.5 million. And a lot of those waste dosages are human error, a vial drops, a vial was broken in transport, those type of situations. Okay. Thank you.
A change that I wanted to make you all aware of is that after more than a year of doing this, I've instructed Secretary Courtney Phillips at LDH to report COVID data on a daily basis, Monday through Friday. So we will not be reporting on Saturday or Sunday, and we haven't been reporting on Saturdays for a while now. But we're going to go to Monday through Friday reporting. And that's effective as of now. So on Saturday and Sunday, you're not going to get the daily update. You will get an update on Monday that will apply for 3 days. It'll have 3 days worth of information for you. Our next press conference will be Thursday of next week at 2:30, unless we have a reason to call you in before that, in which case we will. And with that, I'll take questions. I thought for a moment you didn't have a question for the first time. Melinda?
I was trying to write at the same time. In terms of, it sounds as though this outreach effort is to address a lot of vaccine hesitancy, and I'm listening to the nursing home staff numbers, and again, those are really low. I guess I'm wondering, which kind of communities are you seeing the most hesitancy in, and who are y'all trying to target the most with this outreach campaign?
Well, there are hesitant population centers that are in rural areas, and we have them in urban areas, and we have them across demographics in terms of African Americans and whites. And the outreach effort is certainly an effort to make sure that we're engaging with people who may be hesitant. But it's also an effort to make sure that we are making vaccine available everywhere that we need to by identifying communities that maybe haven't had adequate access up to now, or there's some barrier that we are unaware of, and that sort of thing. But the outreach is hugely important. I continue to be confident that over time, more and more people will overcome this hesitancy and get vaccinated because polling has been consistent that an ever-increasing percentage of individuals will signal their willingness to get vaccinated, but they want some passage of time to happen, and we don't know what that is. And certainly they're using that to learn more about the vaccine, the safety, the efficacy, but also to observe those individuals that they know, whether they're family members or coworkers or whatever, who have been vaccinated, so that they can see what happens to them. But the further we get into the vaccination program, the stronger the track record is with respect to how infrequent serious side effects happen, and the efficacy of this is very clearly demonstrated now with respect to, for example, the case growth in our nursing homes that he just mentioned. So we have more than 80% of our nursing home residents vaccinated. That explains why the number of new cases this past week was the lowest that we have recorded thus far. So it really does work. It keeps people safe. It's safe in and of itself. And the more people understand this, the more they're going to be vaccinated. But obviously, we have to do a better job of communicating that to individuals. And as important as us speaking to individuals, we have to give them an opportunity to share with us what their concerns are so that we can, in a fact-based approach, satisfy those concerns. Because we want to be honest with people. And look, I don't think we're ever going to get to 100% on vaccinations, but we've got to get better than we are. And there are certain areas where, quite frankly, I am troubled. The low percentage of staff in nursing homes who've decided to take advantage of this vaccine is very concerning to me. And we're working with those, the Nursing Home Association and those owners to provide more information, webinars, and asking their medical directors to engage and so forth. And this is going to continue for some time. Again, it's my expectation that over time, many more of these individuals are going to step up and agree to be vaccinated. And this vaccination program isn't going to run for just another month or 2 or 3. And in fact, you're probably going to be dealing with COVID vaccines and booster shots for a very, very long time. Yes, sir.
You saw a number of attorneys general, including Jeff Landry, raise concerns about the tax cut provisions in the new COVID bill. I was wondering if those were concerns that you also shared, and maybe some of your thoughts about that.
No, I don't share those concerns. I'm very thankful for the bill that Congress passed, and quite frankly, we have been exploring revenue-neutral tax reform in this fiscal session for a long time. So it hasn't been a goal of mine to engage in tax cuts right now. So the language in the rescue bill that precludes tax cuts is not a hindrance at all to what I think we should be doing in Louisiana. And why do I say that? Because we know that we have 0.45 cents of sales tax that goes away in 2025. That's $500 million. And so we know that that's going to happen. The other thing is we have, I believe it's the 5th lowest tax burden in the United States of America here in Louisiana when you look at state and local taxes. I think everybody, including the Tax Foundation, legislative leadership, the business community, they know that our tax burden is low. It's unnecessarily complex, and that's why we should engage in tax reform to reduce the complexity so that the nominal rate and the effective rate are much closer, because right now there's a big disparity. And then that will also aid in the ease of administration as well. So there are numerous areas of tax reform that I absolutely agree with, and that's what I think we should be doing now, but we ought to be doing it in a revenue neutral way so that we don't create a structural budget deficit like the one that I inherited when I became governor. I refuse to go back to where we were in 2015 and 2016. It doesn't make any sense. And so it's not a concern that I have, and I'll leave it there. Yes, sir.
Governor, obviously, as vaccinations continue to ramp up, the supply remains steady or will increase in the coming weeks, and you announced an easement of some restrictions a few weeks ago, and little pieces of normalcy are coming back. What do you kind of expect at the rate the state is going, the next pieces of normalcy Louisianians could see? Obviously, you mentioned sporting events yesterday in your radio call. What are some of those pieces people could start seeing of normalcy sooner rather than later?
Yeah, you know, it's a great question, and I'm just very reluctant to try to paint a picture and assign a timeline as to when we're going to get there. But we know that over time, we are going to achieve more and more normalcy. You've already heard me say, and I've been saying it for years, for months, it seems like years, that when our kids go back to school next year, I think it will be very different than it has been because the teachers will have been vaccinated and there are clinical trials now with children. In fact, Louisiana is participating in a clinical trial with Moderna. I believe Pfizer is going to be applying for an amendment of the EUA that they already have to go down very soon, to go down to kids age 12 and above. And so over time, just more and more people are going to be vaccinated, and we're going to have opportunities to get back to a greater sense of normalcy. You've already seen the CDC come out and discuss the issue of whether, if masked properly, school kids can distance at less than 6 feet. And I think the answer is yes, at 3 feet. Beg pardon? Yeah, potentially. So that hadn't been, that's what they're looking at right now. But that's in and of itself is a greater sense of normalcy. And then aspirationally, I was asked yesterday, and I think this is what you're referring to, there are certain individuals, not the least of which is the athletic director at LSU, is interested in having a full Tiger Stadium sometime next fall when they start having these home football games. I would love to see that as well. I hope we can get there. I can't tell you today that I'm absolutely sure of that. But what I can tell you is that if the people of Louisiana really are interested in getting back to normal as soon as possible, they will avail themselves of the opportunity to be vaccinated at the earliest opportunity using whichever vaccine is made available to them first, because they're all safe and effective. And it's not until a big enough percentage of the people get the vaccine that we're going to be able to actually achieve that normalcy. So we continue to encourage people to do that. I'm optimistic that over time more and more people will take advantage of the opportunity, and we're going to have more normalcy. But we're starting to see it already, and I've already mentioned this, and I'm going to mention it again because this is a big deal. I suspect you already have people who, before it was safe and before the CDC said they should do it, they have been gathering together without masks and indoors and so forth. But they've been unnecessarily exposing one another and people they don't even know to the virus. And that has led to people getting sick. That's led to people being hospitalized and to people dying. Now we can do it without the threat of any of that happening. And what better way to visit your loved one than to know that it's absolutely safe to do it. And I'm going to be able to do that now with my mother for the first time in over a year. But this is an opportunity that's being afforded to everybody. Over time at least, because we still have some people who have not yet been deemed eligible for the vaccine. But this is what we're trying to make available to everybody, is to be able to do it safely and to reduce the number of people who are getting sick and going to the hospital. And that ties into what Dr. Cantor mentioned a while ago. There are 14 states that are going in the wrong direction. So if people just out there and they're saying, oh, well, the state's doing well, I don't have to participate because our numbers, there's no guarantee that our numbers stay low and that we don't reverse course and start having increased positivity in cases and hospitalizations again. That easily could happen, which is why we need to reduce transmission while we maximize vaccinations. And that's what we have to do over the next several weeks. I really believe that there's a tipping point coming in several weeks. And if we're successful, we're going to get on the other side of the threat that I just discussed. But we're not there yet. And I hope that people will take this very seriously. And I also want to remind people that there's going to come a day when the pandemic is going to end. But it's not just going to go away. I know there have been some people who, over the past year, who said, well, it's just going to magically disappear. That's not going to happen. The pandemic will end, and then we will have an endemic situation, and the coronavirus is still going to be here. COVID is still going to be here. People are still going to contract the disease and get sick and go to the hospital, and people are still going to die, but not the people who choose to get vaccinated. Yes, ma'am.
Governor, you talked about reading the Hush-Blackwell report, and obviously, there was a legislative hearing about it, and there is another one coming, and several legislators have said that they think LSU's disciplinary response is too weak, and that they think people should have been fired after that report. What do you think after reading that report? Do you think your board members on the Board of Supervisors, or that President Galligan should be firing people and acting more directly in response to the allegations of how people mishandled things in that report?
Yeah, well, first of all, it's a great question. I have read the report, and I will tell you, when you read the report, you cannot help but conclude that people needed to be fired. But over the passage of time, the people who most obviously needed to be fired are no longer there. And so the question becomes, of the people who are still employed by LSU, what is the right punishment, if you will, the right sanctions to be taken against those individuals? I believe what was done by LSU was reasonable in light of all of the information that I was able to gather from that report. And I think it's helpful to understand that those allegations, I think, go back to 2013. That may be the year. That was 2 presidents ago. That was a previous athletic director. That was a previous football coach and others. And the Board of Supervisors, I think there are 2 left of the 15 that were on the board at that time. And those 2 didn't have any knowledge of what was going on there with Coach Miles. And in fact, that report concluded that only 3 board members knew, and for some reason they thought it was appropriate to keep it a secret from other board members. And for some reason, the president at the time and the athletic director at the time thought it was appropriate to only inform those 3 board members. And all of that just defies common sense to me and seems incredibly inappropriate.
Named, who are still on the staff at the athletic department and elsewhere in the university system, who are named, and it is suggested pretty strongly that they mishandled some of these allegations from students. So do you think those people
but
should be disciplined?
I believe the 2 that applies to have been addressed by the administration, the current administration, with suspension without pay for some period of time. And I will tell you that it's my understanding, at least, that Hush-Blackwell, who did the report and does this all over the country at various institutions of higher education, discussed those individuals with the current leadership of LSU as to the range that was most appropriate based on what they've seen elsewhere. And look, I think reasonable people can disagree, and some think it should have been harsher. Some people can think it should have been less harsh. I'm not going to take issue with what LSU has decided to do. I will tell you that we are insisting, and in fact, they've already agreed. I think it's all 17 or 18 recommendations, I can't remember the number, in that report they've decided to adopt and fully implement. And I think that that's going to go a long way. I think you're going to see some efforts in the legislature to address this in the upcoming session. And I look forward to working with the legislature to make sure that we fashion some things that are responsive to what we've seen here. And by the way, the report deals with LSU, but when we pass statute, they apply statewide, because we're concerned about student athletes and staff and faculty all over the state of Louisiana without respect to a particular institution. Yes, sir.
Follow up on that. You mentioned yesterday at the radio interview that you have every confidence that the board will make sure we'll get this solved and follow through with this. Looking at the way the board is constructed, do you feel like when you were putting it together, you should have put more than 2 women on that board?
Looking at it today, I wish I had. I hadn't. I was probably much more intentional about diversity on the board as it related to race than gender. I think everybody that I have appointed to the board are really good public servants and that they do a fine job on the board for LSU. That board does not represent the gender diversity that it should, that's just a simple fact of the matter looking at it today, especially in light of what has been transpiring over the last few weeks. So we will have our next press conference on Thursday of next week at 2:30, and we look forward to seeing you then. I continue to appreciate you all covering this and presenting information to the people of Louisiana, and I continue to appreciate the people of Louisiana, especially those who are doing everything that they can and should to limit transmission by engaging in all the mitigation measures like masking and distancing and so forth, and then honoring the restrictions that we still have, even though they're the least restrictive measures that we've had in place throughout the pandemic. They remain important because if you put too many people too close together, we know that there will be more transmission. So we appreciate everything that everybody's doing. The most important next step is that we continue to do those things as people get vaccinated as soon as they are eligible to do so. So thank you all very much, and we'll see you next week. Full hour.